geography is the application of geographical information, perspectives and methods to the study of health, disease and healthcare. Health geography can provide a spatial understanding of a population's health, the distribution of disease in an area and the environment's effect on health and disease. It deals also with accessibility to healthcare and spatial distribution of healthcare providers. The field is considered a subdiscipline of human geography. However, it requires an understanding of other fields such as epidemiology, climatology. Researchers in India have been laying greater stress on changing environmental factors and its impact on health as a system and on healthcare. In 2012, India is declared as polio-free country by WHO. During last year, no polio cases reported in India. It is interesting to note that disease ecology studies have shifted from the traditional communicable diseases to the more modern diseases such as SARS, bird flu and HIV/AIDS. There is a link between environmental factors, agricultural practices, nutrition level, health and disease. The environment including physical, biological and socio-cultural conditions plays a dominant role in determining the health status of women. Increasing incidences of tuberculosis, bronchial asthma, lung and breast cancer due to exposure to air pollution, skin diseases due to contact with polluted water and soil, urinary tract infection due to poor sanitation conditions and stresses and strains of the physical and social environment leaving their imprint on the mental health are some of the problems faced by women. Increasing environmental pollution resulting from industrialization and technological development has become a matter of global concern. Therefore, the impact of air, noise and water and land pollution on human health has become an important area of study by geographers. According to the World Health Organization, better environmental management could prevent 40% of deaths from malaria, 41% deaths from lower respiratory infection and 94% of deaths from diarrheal diseases. This translates to 13 million deaths each year, 5 million of which are children, and these threats are not restricted to developing countries. The possible impacts of climatic change on human health are one of the burning issues that have also been addressed by Indian geographers. Akhtar in 2007 has observed the changes in climate in Kashmir and the consequent impact on the local population. The growing threats of diseases arising due to various natural hazards has been focus of the study. Akhtar has emphasized on the various health problems that can result from the tsunami strike and has outlined a holistic framework of study of health and disease that need to adopt it under the circumstances. The information on this module is divided into 5 parts to understand health geography as a whole with its new application and approaches. First one, geographical distribution of healthcare facilities in India. That includes number of primary health centers, hospitals, community health centers and facilities at these centers. Second module is geographic information system. Third one, environment and health, case study of Karnataka. Next module, urban slum and distribution of disease. Next, spatial distribution of health state-wise. Location of healthcare facilities has been a significant area of study by medical geographers. Distribution of settlements and settlements having health facilities are prime concerns with respect to health geography. Geographers also assess the possibilities of employing geoinformatics in promoting the use of local health tradition and thereby provide affordable healthcare option within the reach of the common man. As on March 2010, there are 1,47,069 sub-centers, 23,673 primary healthcare centers and 4,535 community health centers functioning in the country. Number of sub-centers existing as on March 2010 increased from 1,46,026 in 2005 to 1,47,069 in 2010. There is significant increase in the number of sub-centers in the states of Chhattisgarh, Haryana, Jammu Kashmir, Maharashtra, Orissa, Punjab, Rajasthan, Tamil Nadu, Tripura and Uttarakhand. The sub-center is the most peripheral and first contact point between the primary health care system and the community. Each sub-center is required to be manned by the least one auxiliary nurse midwife, that is ANM, female health worker and one male health worker. The sub-centers are provided with basic drugs for minor ailments needed for taking care of essential health needs of men, women and children. Primary health center is the first contact point between village community and the medical officer. The primary health centers were envisaged to provide an integrated, curative and preventive health care to the rural population with emphasis on preventive and promotive aspects of health care. As per minimum requirement, a primary health center is to be manned by a medical officer supported by 14 paramedical and other staff. The activities of primary health center involves curative, preventive, promotive and family welfare services. As per minimum norms, a community health center is required to be manned by 4 medical specialists, that is surgeon, physician, gynecologist and pediatrician, supported by 21 paramedical and other staff. It has 30 indoor beds in 1 OT, X-ray, labor room and laboratory facilities. It serves as a referral center for 4 primary health centers and also provides facilities for obstetric care and specialist consultation. An existing facility can be declared a fully operational first referral unit only if it is equipped to provide round-the-clock services for emergency, obstetric and newborn care in addition to all emergencies that any hospital is required to provide.